Hello, my name is Andrea Bailey, and I am the Acting Director of FEMA. This public announcement is to report and educate the public on the reported rise in deaths seemingly from influenza. Following protocol for an emergency due to an outbreak of a deadly virus, we have assessed that on December 15th, one of the nation's largest research facilities, known for coordinating efforts to tackle the annual influenza virus, released a vaccine in September that mutated into a deadly infection. This outbreak does not appear to be related to bioterrorism. However, we await further confirmation from the FBI and the CDC to confirm this fact and rule it out. Upon analysis conducted by our scientists in conjunction with the CDC, we have been able to identify that half of the doses of the synthetic vaccine have been found to mutate when contacted with the body's T cells within 30 days of injection, causing severe acute issues that start off with vomiting, diarrhea, high fever, headache, all thought to be influenza. Within 3 to 5 days after these initial symptoms, the mutated vaccine then attacks the nervous system, causing paralysis and/or death. The total number of people affected by paralysis is 256,987, spread over several states between 3 and 5 of, of initial symptoms, and the death toll has reached 54,267 cases on either day 5 or 6 of initial symptoms. It is important to note that not all who were paralyzed died, but remain in a paralyzed and/or comatose state. The reports made to the CDC from hospitals and physicians enlisting epidemiological means were traced back to the mutated vaccine batch. This particular facility manufactured and distributed the vaccine to 21 states within the Northeast and Midwest regions of the nation. These states are Maine, Connecticut, Massachusetts, New Hampshire, Rhode Island, Vermont, New Jersey, New York, Pennsylvania, Ohio, Michigan, Indiana, Illinois, Wisconsin, Minnesota, Iowa, Missouri, Nebraska, Kansas, North Dakota, and South Dakota. A detailed population breakdown results in the following statistics. The initial illnesses were discovered in 9 states. Most prominent are Maine, New Hampshire, Ohio, Kansas, Minnesota, North Dakota, South Dakota, Indiana, and Iowa, totaling 45.9 million people in those states. Last reports identify the highest infection population to fall ill as over 2 million people across the states of Ohio, Maine, Minnesota, Iowa, and Indiana. More specifically, as of December 15th, paralysis patients equal 256,987 cases, and deaths from the paralysis again are 54,267 cases. While it appears that only half of the second batch was contaminated, the vials were mixed when packaged, and therefore there is no means of knowing which vials contain the infected vaccine. However, we have confirmed that the vaccine was not available to the public from October 1st to December 15th. Following distribution and release, it has been confirmed that 75% of the vaccine was given to individuals in the described population, and the remaining 25% is on its way back to the CDC for analysis and eventual destruction. Please seek immediate medical attention if you begin to experience symptoms such as severe vomiting, diarrhea, high fever, headache following an influenza vaccine. At this time, no counteractive drug has been identified. However, the CDC is diligently working on it and expects to have more details when the remaining vaccines arrive following analysis. Further updates and more detailed information on this matter can be found on the websites listed below as cdc.gov and or fema.gov. An important disclaimer. This fictional video was composed for a class project with Ashford University, Class HCA 415, Community and Public Health. Thank you.